What is the process of a broken ankle? What my inquiry question is about? My inquiry question is about understanding the causes, treatments, and recovery for broken ankles. How it is comprehensive and covers a wide range of essential aspects, addresses both the physical and psychological dimensions, which is crucial for a holistic understanding of the impact of ankle fractures on individuals. Imagine this. The sound of a crack echoes through the air as a misstep, a sudden fall, or a moment of impact leads to a common and intricate injury, a broken ankle. Beyond the initial pain lies a complex journey of understanding the anatomy, navigating various causes, exploring treatment options, and witnessing the determination in the recovery process. Join us as we unravel the layer of broken ankles, explore not only the bones and ligaments, but also the resilience and psychological that shape the narrative of this prevalent orthopedic injury. So you have the anatomy of the ankle. There's the tibia, which is also known as the shin bone. The tibia is the larger of two lower leg bones and is positioned on the inner side of the leg. It bears the majority of the body's weight and serves as a stable support for the ankle joint. Then you have the fibula. The fibula is the smaller of two lower leg bones and runs parallel to the tibia on the outer side. Although it does not bear as much weight as the tibia, the fibula contributes to the overall stability of the ankle. Then you have the talus. The talus is a small, wedge-shaped bone that sits at the top of the heel bone and forms the lower part of the ankle joint. It plays a crucial role in transmitting the body's weight from the tibia and fibula to the foot. Then you have your ligaments. Ligaments are tough, fibrous tissues that connects bones to each other, providing stability to the joint. In the ankle, several ligaments such as the anterior talofibular ligament, also known as the ATFL. There is the posterior talofibular ligament, PTFL, and calcaneofibular ligament, CFL, to support and stabilize the joint. Then you also have your tendons. Tendons are strong bands of connective tissue that attach muscle to bones. In the ankle, the Achilles tendon connects the calf muscles to the heel bone, allowing for movements like plantar flexion, which is pointing the foot downwards. So your causes of the broken ankle, you have traumatic injuries. There's falls, accidental falls, especially from heights, can lead to ankle fractures. There are sports-related incidents, so like high-impact sports, sudden twists, or direct blows during athletic activities can cause ankle injuries. You have vehicle accidents, so like car crashes or accidents involving motorcycles or bicycles may result in ankle fractures due to the force of impact. There are stress factors, which is like repeated stress on the ankle over time can lead to tiny cracks in the bones, known as stress fractures. Common in athletes, dancers, or individuals engaged in high-impact activities that place exercise or excessive strain on the ankle joint. Then you can also twist or roll the ankle. Awkward landings or sudden changes in direction, especially during physical activities, can cause the ankle twist or roll, leading to fractures. And then there's direct impact, which is would be a blow or like a blow to the ankle, such as being hit by a heavy object, which can result in a fracture. Another cause would be osteoporosis. So weakening the bones due to conditions like osteoporosis can make them more sustainable or susceptible to fractures, even with minor trauma. You have improper footwear. So wearing shoes that lack proper support or do not fit well can contribute to instability and increased risk of ankle injuries. You can also have weak ankles or muscles. So poor muscle strength or weak ankles may make individuals more prone to ankle injuries. And age is also a factor in it. So older individuals may be at a higher risk of ankle fractures due to factors such as reduced bone density and balance issues. Then congenital conditions. So some individuals may have congenital conditions or abnormalities that affect the structure of the ankle, increasing the risk of fractures. Then the diagnostic procedures for the broken ankle, you can have your x-rays. So x-ray is the most common and initial diagnostic tool used to assess the ankle fractures. X-rays provide detailed images of the bone, allowing healthcare professionals to identify the location and extent of the fracture. Different views such as anteroposterior, lateral, and oblique may be taken to obtain comprehensive information. And you have CT scans. CT scans may be recommended in certain cases, especially when a more detailed three-dimensional view of the fracture is needed. CT scans can provide additional information about the alignment of the bone fragments, helping in surgical planning for complex fractures. Then you have your MRI. So MRIs are not typically the first-line diagnostic tool for the ankle fractures, but may be used in specific situations. MRIs provide detailed images of soft tissue, ligaments, and tendons, offering more comprehensive assessment of the injury. Then you have your bone scans. So bone scans involve the injection of a small amount of radioactive material that is absorbed by the bones. While not commonly used for routine ankle fractures, bone scans can be helpful in detecting stress fractures or assessing blood flow to the bones. You also have your ultrasounds. So ultrasound imaging is less common in diagnosing ankle fractures, but may be used to assess soft tissue injuries such as ligament damage or swelling. So for treatment-wise, once you break your ankle, you could have surgery or not have surgery. So a non-surgical treatment would be mobilization of casts or braces. Stable fractures may be treated with the application of a cast or brace to immobilize the ankle and promote healing. The cast or brace helps to align the broken bones properly and prevent movement during the healing process. But if you need surgery, you'd have internal fixation. So unstable fractures where the bones are significantly displaced or broken into multiple pieces may require surgical intervention. Internal fixation involves the use of screws, plates, or rods to stabilize the bones and facilitate proper healing. So there's physical therapy. So first, they'll give you your initial assessment. The physical therapist will conduct an initial assessment to evaluate the extent of the ankle injury, including the type and severity of the fracture. They'll look over your surgical history and your overall physical condition. Then there's pain management. If there's still pain and swelling in the ankle, therapists may employ techniques to manage pain such as ice therapy, gentle massage, or electrical stimulation. Then they'll give you range of motion exercises. So like gentle range of motion exercises are introduced early into the physical therapy process to prevent stiffness and maintain flexibility. Some exercises could be ankle circles, toe taps, and dorsiflexion/plantar flexion exercises are commonly introduced too. Then you have your strengthening and exercises. So progressive strengthening exercises are incorporated to rebuild the muscle around the ankle. Initially, exercises may focus on isometric tractions and progress to resistance exercises using resistance bands, weights, or resistance machines. Then balance training. Ankle fractures can affect balance and proprioception, which is like your awareness of your body position. And therapists include exercises to remove these aspects. Balance exercises in stable and unstable surfaces, as well as proprioception drills, help enhance ankle stability. Then you have gait training, which is restoring normal walking patterns is a key goal. Therapists work on correcting any abnormal gait patterns that may have developed due to the injury. The use of assistive devices like crutches or walkers may initially be required and gradually phased out as your walking improves. Then you have your functional activities. Therapy includes specific functional activities tailored to the individual's needs and daily activities. Tasks such as climbing stairs, squatting, and transforming from sitting to standing may be incorporated. Then you'll most likely get a home exercise program. So patients are often provided with a home exercise program to continue their therapy outside of scheduled sessions. And consistent engagement in home exercise is essential for optimal recovery. Then you have progressive overload, which as the patient's strength and endurance improves, the therapist progressively increases the intensity and complexity of exercises to promote further recovery. Then there's also education you have to learn. So patients receive education on proper body mechanics, injury prevention, and self-management strategies to minimize the risk of a re-injury. Because once you broke your ankle once, you have a higher chance of doing it again. Then there's monitoring and adjustments. The physical therapist monitors and progress and adjusts their therapy plan as needed, ensuring that the program involves with the patient's improving condition. Then your recovery time for broken ankle. So the immediate treatment is like week 1 to 2 after you break it. So that's emergency care. So if the fracture is severe, immediate medical attention is crucial. Initial treatment may involve mobilization, pain management, and if necessary, surgical intervention. Then you have immobilization. So for non-surgical cases, a cast or brace is applied to immobilize the ankle, providing weaker bones to heal properly. Then you have your initial weeks, which is week 2 to 6. So that's protected weight bearings. Depending on the severity of the fracture, the patient may be advised to avoid putting weight on the affected ankle initially, or may be allowed to engage in protected weight bearing with the use of crutches or a walker. Then you'll begin physical therapy. So early physical therapy may commence to address range of motion, pain management, and prevent stiffness. Strengthening exercise may be introduced gradually too. Then you have your mid-stage, which is like weeks 6 to 12. Just transition to partial weight bearing as healing process. The patient may gradually transition to partial weight bearings and eventually full weight bearings. So then you have intensive physical therapy. Physical therapy intensifies to include more advanced exercise for strength, balance, and flexibility. Then you have your gait training, which is working on restoring a normal gait pattern, becomes a priority. Then you have your late recovery, which is like weeks 12 to 24 and also later than that. So that's full weight bearings. By this stage, many patients are able to bear full weight on the injured ankle. They have advanced therapy, physical therapy, which continues to focus on advanced exercises, functional activities, and sports-specific movements if available. Then you have monitoring and your adjustments. Progress is also continually monitored by the physical therapist, and the plan may be adjusted based on the individual response to treatment. Then you also eventually will return to activities. So the timeline for returning to normal activities, including work and sports and stuff like that, can be very different depending on your injury. It may take several months to a year or more, depending on the complexity of the fracture and the individual's progress. Return to sports or high-impact activities is typically a gradual process with the clearance of the healthcare provider and physical therapist. Psychological impact having a broken ankle does to you. So it gives you pain and discomfort. So dealing with the physical pain and discomfort associated with a broken ankle can lead to feelings of frustration, helplessness, and irritability. Persistent pain can continue to emotional distress. Then you have loss of independence. So an ankle injury often restricts mobility and may lead to temporary loss of independence. Individuals may require assistance with daily tasks, leading to a feeling of dependency and frustration. Then your impact on daily life. The inability to perform routine activities such as walking, driving, or engaging in hobbies can lead to feelings of isolation and sense of being disconnected from one's normal life. Then it can also cause anxiety and depression. So the sudden change in the lifestyle and the challenges posed by the injury can contribute to feelings of anxiety and depression. The fear of not fully recovering or concerns about the future may also contribute to these mental health issues. There's also body image concerns you might get with this. Individuals may experience body image concerns, especially if the injury requires the use of a cast, brace, or mobility aid. Changes in appearance are limited. Physical activity can affect one's self-esteem. For example, once you get a cast off that, say you have it on your ankle, your leg will probably be way smaller than it was before, since you aren't using it all for most likely 6 weeks or more. Then the impact on work and social life. So an ankle injury can lead to disruptions in work and social life. So like missed work days, you can miss school, social interactions, and the need to decline invitations or activities can contribute to a feeling of isolation and loneliness. Then there's frustrations with the healing process. The gradual nature of the healing process may lead to frustration and impatience. The individuals may desire quicker recovery and may be challenged by setbacks or delays in the healing timeline. You also have your fear of re-injury. After experiencing a broken ankle, individuals may develop a fear of re-injury. This fear can impact their willingness to engage in physical activities or may affect their confidence in the healed ankle. Then there's also stress on relationships. The emotional toll of a broken ankle can also extend to relationships. Family members or caregivers may experience increased stress, and the injured individual may require additional emotional support. Then this is my personal experience of a broken ankle. So when I was 14, I had my first baseball practice with my new team. Towards the end of it, I was running to first base and I stepped on the edge of the base. And when my ankle hit it, pronated and snapped. At first, I didn't feel any pain, but I couldn't move my ankle at all. I was then driven to the hospital. I waited around 3 hours to get my x-rays done and then be put into my cast. My x-rays showed that I had a break in one bone and a fracture in two, but I wouldn't need surgery, thankfully. I was in the cast for around 6 weeks and had to spend another month or two in a walking boot while I started my physiotherapy, which I had to do for months. Breaking my ankle was pretty hard on me mentally. For the most part, I was stuck in my bed for 6 weeks in pain and annoyed. And when I was first able to walk again, I couldn't walk properly, and I honestly was afraid to walk for a while. I was also afraid to play baseball again, and when I was playing, I was in pain most of the time at the start, and I had to be really careful on what I did. I had to stretch a lot, I had to wear an ankle brace some of the time, and the pain in my ankle never fully went away. I still get it sometimes when I'm playing, and I'm still worried about hurting it when I play to this day.